My name is Ralph Hills. I'm in the United States. I've been an AML patient and still get treatment for 12 years. I'm very fortunate. I'm also the chair, the patient chair of Know AML in London. My experience is that once you find out you may have cancer, you immediately lose clarity of thought. You go into a fog of the unknown and fear. And meeting with your oncologist does not clear that up. So the first thing I recommend is, if you can, take an adult family member with you to keep the process going. And then once the meeting starts, it becomes clear there are really only two real questions that you might have. And the first one is this a life-threatening illness? Do not expect the doctor to tell you if you will live or die, but maybe something like what happened to me. Go home and get your affairs in order. That can be a tough moment. The second question you probably want to ask is, are there treatment options that can help me now, and how would they change my life? If you do have AML, yes, it will change your life, maybe for a long while. Actually, remember to ask if it will change our lives, because friend and family will also be changed, maybe for a long time. I have had monthly 12 treatments still after 12 years. Now it's critical that you and your caregiver do the best to listen to your doctor, even if it seems very confusing. Recommend that you listen very carefully and try to find out what to expect the next few weeks or months. But you also might want to consider two additional delicate questions. If you do have an AML diagnosis, the next question has to be, are you an AML specialist or oncologist? This is because AML analysis or treatments are varied and complex. And finally, should I get a second opinion? Probably yes.
I'm Anna Mamwell. I'm actually in the UK and I'm a Know AML ambassador. I was diagnosed with AML in 2015 and I've been in remission ever since. So what questions would I recommend? I think firstly, the first thing I always sort of say to people is ask anything that pops up to you that you feel is important. Don't feel like scared to ask whatever it may be, because it may seem, you may think, oh, it's a small thing, but it can really make a difference to you. So I always sort of say to people, don't be afraid to ask anything. It could be something like, following on from what Ralph said, what about my family, or those kind of things. So of course you've got your medical questions and things like that, but I think also there can be little things that you just need to know just to help you feel more comfortable. And I think sometimes when you're first thrown into this situation, because you are really thrown in at the deep end, you just are like in a fog of I don't know, shock and disbelief and those sorts of things. I think it's okay to have that, to feel that, and it's okay to have that time to think about what you want to ask as well. I think I always say to people, make note, take a notebook with you. If any questions crop up to you when you've come away from the consultant and before your next appointment, write those down. Don't be afraid to ask them to repeat something or to explain it in more easier language, because I think sometimes they can sort of forget it's something they deal with all the time, but for us it's our first time, and I think I agree with Ralph with questions that he said to ask, so I won't repeat those sorts of things, but I think for me there were other things, because I was a mother. My daughter was 8 at the time and I was working, and it affected all those things. So we had lots of questions, but for us, we were also able to, and Ralph mentioned carers as well. So one time my mum emailed the Macmillan nurse. We have like a support nurse throughout our treatment in the UK, and she did email her things, and so did my husband. So when things cropped up, then they would email, and then she would, in good time, either answer the question if she could, or she would ask the consultant on our behalf. So that's kind of the first thing that I would say to people.